is Fox 5 News, the most powerful name in local news.
A special Fox 5 health segment is next.
Yeah, and look who's here. Dr. Doris Day is joining us, and she brought along with her a new cancer screening device that looks for melanoma in its early stages. And she's going to show us how it works on the other side of the break. Keep it right here on Fox 5 News at 5. And we're back now with Fox 5 Health News Tonight, a new skin cancer device that can help dermatologists get a better look at a possible melanoma. It's called MelaFind. This high-tech device can help cut down on unnecessary biopsies and help doctors detect the deadliest form of skin cancer when it's most curable.
All right, now joining us with more is dermatologist Dr. Doris Day. She's an assistant clinical professor at NYU Medical Center. Thanks so much for coming in and bringing this for us.
This is great.
So we understand that you actually use this device in your office. How is having something like this done better than your naked eye?
Well, I'm really excited to have a new diagnostic tool that can help me evaluate moles and brown spots on the skin and potentially even evaluate for a melanoma early, because if you think about it, melanoma is the deadliest form of skin cancer. Nearly 1 person dies in this country every hour from malignant melanoma.
Wow.
And these are the highest numbers are young women, and 29 to 35-year-old. It's one of the highest form of cancer deaths in that age group, and in men in their 60s. So everyone needs to have a skin cancer screening every year. Now, when I'm looking at brown spots on the skin, if I see one that I'm not worried about, I don't need an extra scanning device or diagnostic tool to help evaluate it. You can just tell by
looking at it.
That's right.
Okay.
And if there's one that I'm more worried about, then I know that I need to remove that. I don't need a diagnostic tool to help me.
Okay.
And I have criteria. I have my ABCDEs: asymmetry, border irregularity, color variation, diameter, if it's a little bit bigger, or if the patient tells me that it's changing or evolving. And I have other evaluating tools like a dermatoscope and a magnifier that I can look at as well.
Okay, this is something new now. This is MelaFind, right?
This is
so
MelaFind.
You brought this in for us to see how it works. And unfortunately, we have a patient with us.
Perfect.
Hello,
Yeah,
how are you?
let's see.
So as I explained it, we can
volunteering.
also do a scan do an evaluation of a lesion.
Okay, so let's say you've looked at the patient now.
Yes.
You've decided what? That one looks a little questionable?
So I've picked out one that I have a question about that is a little bit irregular to my eye. And what's so exciting about this device is it does help me evaluate looking at wavelengths of light that I can't even see with my naked eye. And also, it gives me an output at the end and a classification. So I can look at all different parameters and even see how it's thinking.
So you're going to look into that thing? Is that
so without any pain, without any cutting into the skin, in less than a minute.
You didn't feel that?
How was that?
Absolutely not.
Okay.
We can look into different layers of the skin, and you can see it scanning down through the skin. So I use that word, but it's evaluating this lesion all the way down to about 2.5 millimeters, and then it gives me an output of high or low and a classification within that, so that I can even prioritize. If I look at a few different spots that I had concerns about, I can prioritize as to what needs to be removed. I can see the borders, the variation, how deep it may go into the skin. And we keep a copy of this, so even after I remove it, I can go back and look at it again and learn more.
And the key here is that you're able to detect this. You're able to discover what it is and decide if you need to remove it without a biopsy.
Absolutely, so important. And there's a great website for this as well. There's MelaFind.com that has a way of looking at different moles that were looked at with it, and also more information about it. But it's really a great diagnostic tool that can help me. Now that this came back low, I feel much more comfortable watching this. And when she comes back, I can look at the picture again and look at the spot and see if there's any change or anything that I need to look at. So,
Doctor, I just wanted to ask you, at what stage can you look at something?
So it has to be a certain size, 2 millimeters or bigger. And it has to have some pigment or color to it. It's not for lesions that may be skin colored or pinkish. It's really for any brown spot that the dermatologist decides has some level of suspicion to it. So it's not meant to look at the whole body.
That's it, right?
It's not doing the thinking.
It's not a body
helping me
scan,
evaluate.
right?
That's right.
Because a lot of people would think that perhaps that's what you can do, but that's not how it's used.
It's not used that way. It's helping me evaluate moles or brown spots that I have a level of suspicion about, that I can then use this to look through the skin in wavelengths of light that I can't see, and I can see how it's evaluating it. I get that great output of high or low and a classification within that from 0 to 9 that can help me prioritize what I need to do. And then I can go back and look at it again even after I remove it if I choose to. If I remove it, I'll still send it to the lab and get a diagnosis by histology from a lab.
And pretty reliable, you were telling us, right?
Oh, it's
this really
fantastic.
does the job.
It does. It helps me so much in prioritizing, and I'm so relieved sometimes when I look at something and someone who doesn't make a nice scar. People can make keloidal scars, or it's on the chest in an area where you don't want to have a scar if you don't need one. So I can really spare a scar, and sometimes if I need to, we have that greater level of confidence that it was necessary, and so we can feel good about that too.
So could this be the type of situation though that, say, like you're looking at your own body and you see something that is questionable to you and you come in?
Yes.
And then, okay.
Absolutely. That's one of the criteria that we look at as dermatologists. If patients come in and they say, you know, this always looked one way and now it looks different, sometimes we'll be able to look and reassure, but oftentimes we'll remove it because change is one criteria that we use. But now we have another diagnostic tool that can help me evaluate it, and often that gives patients comfort as well.
As a patient, does it make you feel comfortable?
Absolutely. I feel a lot better seeing that result.
Good. Terrific. This is great. Thank you so much for sharing all this. It is very encouraging. We like to report stories like that. Thanks for joining us.
Thank you.
Dr.
Appreciate
Doris
it.
Day.